And we want to discuss seasonal affective disorder with Dr. Barbara Bumberry. It's a long-running joke Lauren and I actually have about how January and February are so tough to try and get through. And if you noticed at home, she's been off this week. Took a little vacation. That's smart of her, right? That's one way to fight this, but can you help us out with a little bit of what this is exactly?
Sure. Seasonal affective disorder is basically depression-type symptoms that we experience at the same time every year or most years. It's usually in the fall, in the winter. It's much more common in women. 4 to 1, it affects women over men.
Really?
Typically women of childbearing age. We don't see it very often in older adults, and it's not in patients that are already being treated for depression.
Yeah, and so is it something that you see because, again, we were talking with Elisa, we haven't seen the sun in a few days, it's bitter outside, it's kind of all that just kind of has you dragged through, right?
Yeah, there's several theories. The most prominent one is that it has to do with disruptions in our circadian rhythms, but it can also be due to retinal sensitivity, eye sensitivity to light, genetic variations, neurotransmitter abnormalities.
We're still halfway through January, so we still have a ways to go in the winter right now. How do we help treat this?
So the three main therapies are light therapy, medication, and cognitive behavioral therapy, or talk therapy.
How about light therapy?
Light therapy is where you have a special light, not just indoor lighting, but a special light that produces brighter intensity than your usual lamp or ceiling light. 10,000 lumens is what's usually recommended, and they're usually desktop. You set about 12 to 18 inches from it. You don't have to look directly at the light, but you want to make sure it can hit your eyes, and you do that for about 30 minutes every day. Usually within about 1 to 2 weeks, you can start seeing some improvement. And if it's something that you suffer from every year, you can start doing it like in the early fall before you typically have symptoms, and it can be preventative for the following years.
And of course, we know about medications and things. Light therapy is something that you'd suggest go see your doctor to maybe get some more, some help to do it properly, right?
Right. And with the light therapy, I was looking online. You can buy a good one for less than $250. I was on Amazon this morning. You can buy one for less than $32.
Wow. Okay. Not bad at all. Ways to try and help get us through these tough winter months. Dr. Barbara Bumberry, thank you very much for joining us this morning.
You're welcome.